Ryan Reynolds here for, I guess, my 100th Mint commercial. No, don't. No. I mean, honestly, when I started this, I thought I only have to do like 4 of these. I mean, it's unlimited premium wireless for $15 a month. How are there still people paying 2 or 3 times that much? I'm sorry, I shouldn't be victim blaming here. Give it a try at mintmobile.com/save. Whenever you're ready.
$45 upfront payment equivalent to $15 per month. New customers on first 3-month plan only. Taxes and fees extra. Speed slower above 40 gigabytes. See details.
This episode is brought to you by Atlassian. Atlassian makes the team collaboration software that powers enterprise businesses around the world, including over 80% of the Fortune 500. With Atlassian's AI-powered software like Jira, Confluence, and Loom, you'll have more time to do the work that matters. In fact, Atlassian customers experience a 25% reduction in project duration per year. Unleash the potential of your team at Atlassian.com. Atlassian.
The Dental Download podcast is your source for insight from conversations with fellow dentists, specialists, and leaders in the industry. With new episodes every Monday morning, I'm your host, Dr. Haley. Let's get into this week's episode. All right. Hi, everyone. Welcome back to another episode. And we have a really exciting guest here today. I've been meaning to get Dr. Shahid on the podcast for years, I feel like. So I'm so happy to have you here. Could you just introduce yourself and tell us a bit about your background in dentistry?
Yeah, well, first, Haley, thank you for inviting me on. My name is Dr. Rehan Shahid. I've known Haley you for quite some time now when you were a dental student, so it's kind of nice to see you kind of grow up into the dental role as a dentist as well. For those of you guys that don't know me, I am a practice owner of 4 offices. I also run a dental assistant school, and I also do dental coaching on the side. And just started realizing my passion has been more toward coaching now, and I've been enjoying that process, being able to lead and teach doctors and teams how to do better.
You have your hand in so many different things. I'm sure it keeps you very, very busy. But I want to kind of introduce a format that I do on the episodes when it's just myself. I want to start doing it with guests as well, because I kind of use the individual episodes as a chance to reflect on like what I've been learning as a practicing dentist, like month to month, all the different changes going on and ways that I stay motivated, and I'm always trying to learn new things, basically. So I would love to know what's something that's been keeping you motivated this week, or something that you're really excited about.
So one thing that's been keeping me motivated this week is just realizing how passionate my team is trying to hit the goals that we've assigned for ourselves. We kind of do some pretty awesome goals where we have certain prizes that we dedicate, and it's just nice because it's like a personal win. Like, hey, I'm this much closer to hitting that goal, and that kind of motivates me too at the same level. I have a higher goal than they do in certain aspects, and I'm just a very goal getter type of person. So that personally motivates me.
That's awesome. I know the office I just started working at has like monthly bonuses for their team. So it seems like that's a big motivator for people. Of course, you want to find intrinsic value in your job, but some kind of physical bonuses or, like you said, rewards, things like that really do, I think, make a difference for everyone and keep everyone really excited to be coming into work every day.
Yeah, definitely. And monthly bonuses or just kind of events and stuff like that, those definitely go a long way.
And you're many years into practice now, but is there anything that sticks out to you as something that you learned this week? It doesn't have to be clinical. It can be interpersonal, business, through your coaching, anything like that.
One of the personal things, I guess, this week of work was getting better at praising. As a dentist, we kind of stick into our own little operatory, do our work, and as an owner, we kind of do our day and we don't remember we have team members that are people too. And as a dentist, we work really hard. We just don't remember that we also have team members that are working equally as hard with us. So really taking a pause and saying, hey, assistant or front desk, thanks for being here today. You could have done anything in the world, but you chose to be here today at work with me, supporting me in achieving my dream, and hopefully realizing your own dream with me. So I appreciate that. So just being able to work on praising a little better and more often.
Yeah, I'm sure that goes a really long way and is an extra big challenge when you have multiple offices, because you're not probably in every single office every day, right?
Yeah, so I'm in one office, but my goal is to be able to create leaders within the other offices that kind of serve as my right hand.
So Can you tell us a little bit about from graduating dental school, how you got to where you are now?
Yeah, so I'm a what you call a COVID grad. COVID happened, and as everyone knows, COVID messed a lot of things up. And at that point, I was graduating and I was looking for jobs like everyone else. I was cut off on half of my education, so I didn't know if I was going to be ready for dentistry. And so I went to a job, and a dentist interviewed me and said, "Hey, I will let you do cleanings, and maybe after 6 months, I'll let you do your first filling." And and he's like, "I'll also give you like $30 an hour for it." And so he was kind of paying me less than a hygienist. And at that point, I was like, "No, I went to 4 years of dental school. I don't want to do this." 2 years or 2 days later, he actually passed away, unfortunately. And so one of his last things he said to his wife was, "You remember that guy that came to interview? Sell him the practice." And so I actually lucked into my first practice because of that. The 2 months out of school, I bought my first practice. We I work alongside my brother. So he was already a practicing dentist, and we both wanted to buy one originally. We kind of lucked into this doctor unfortunately passing away and buying one. And then in another town close to our home, another doctor just wanted to sell and get out because he just had enough because of COVID. So we thought, hey, well, we already took the risk and bought one. Why not just go and buy two? There's two of us. And so we bought two. And every year since then, we bought one more practice. And so now we're at 4 practices now.
Wow. And what's it like working with family, being a partner with your brother? I'm sure there's pros and cons.
I mean, there's always pros and cons with family. I think we definitely bicker for sure. I think it's a healthy bicker though. So I love having someone challenge me too, because if I had someone as a partner that just listened to everything I said, then I would never grow myself. So when someone's able to challenge me in a productive way, it fuels me to become better and just work on improving my own self too.
And obviously, in your situation, it just kind of made sense to go into partnership with your brother. But do you, for all the reasons you just mentioned, recommend people consider maybe a group practice or a partnership model rather than the more old school solo ownership pathway?
I think it depends on what your goal is. For us, it was I want to create a legacy, and I'm a big book reader, and I believe if you want to go far, you can't go alone. You have to go with someone. There's a old proverb: if you want to go fast, go alone. If you want to go far, go together. So I knew the goal that I outlined for myself. For me to get there, I cannot go there alone. I have to have a team surrounding me, and so knowing that in the very beginning allowed me to go faster in the goals that I want to achieve.
And on the topic of books, that was another thing I wanted to ask because you always have really great book recommendations that you've shared with me and that you just often share through your coaching and everything. So if you had to think of one book for a recent grad dentist, what's the first one you would recommend that they pick up?
I personally like The Pumpkin Plan. So it's a book called The Pumpkin Plan, weird, funny name. And it teaches or it talks about how you should identify your goals of life and how you should bring people into your life that propel you forward to achieving those goals. So it's a cool book in it. And if I had to say one of my successes was one of those books, and every successful person is a book reader and they have their own list of books, and The Pumpkin Plan makes the top 10.
Yeah, I think that's so key ideally you've thought about it before you're graduating dental school, but to really focus on your why for all of your motivation and like your long-term goals and setting up your day-to-day to be the person that's going to achieve that. Like all those things that so many of those books talk about, and what you're saying with surrounding yourself with people that are going to help support you in that mission that you have. But I also think it's important to always go back, revisit what you think that you're working towards and kind of check in, like, am I doing all the things I said I would a few years ago, and really try to evaluate that too.
Yeah, we tend to turn into this robot often where you graduate as a dentist and you start doing dentistry because you were passionate in helping people, and then you realize it's now doing the same thing over and over again and you forget why you did in the first place. So it's nice to be able to realign that vision and making sure it's what you wanted.
Do you have any personal practices that you do for goal setting or for checking in with yourself that you found to be effective?
So there's a book called Vivid Vision. And one of the requirements the book says is you have to go out in nature for a whole 5 to 8 hours. And the book essentially requires you maybe every quarter, go out into nature or a piece of serenity or place of serenity, and you just think about what your vision looks like in such a way that you can grab it. So meaning you put yourself in a present tense, hey, I own 10 offices. Executive team looks like this. And you start creating this map of what that looks like as a vision around you in a present tense. And you write it on paper, and it allows you to kind of picture physically what you want to achieve. And I think that was a good exercise that I like to do at a quarterly level to make sure the vision that I have, am I still on track? Does it change? Am I deviating at all? Or am I off track?
And I'm also curious when it comes to the practice. You mentioned that one of your goals is like creating a legacy. So what is kind of the mission of your practice that makes it stand out, or kind of what is that legacy you're hoping to create?
So for my current practices, we're in Northeast Texas, and our mission is to be able to serve our Northeast Texas area while providing comfort, compassion, and just really high quality care for the people around us within the communities we serve. My personal vision beyond that is for me to create a legacy and to impact the most amount of people. I'd have to see 1 million patients if I wanted to do that, but I know I can't do that. So what I have to do is, can I invite other dentists and then through them coach them to be better? And when they get to serve people, it's in a sense me serving them because I taught them something. And so for me to make the biggest legacy that I can, I have to impact the most people that I can. And in doing so, I get to impact the most patients that I can.
And looking back, graduating during COVID, you mentioned you weren't even so confident in your own skills, and now here you are teaching other people. So what happened in that time that allowed you to improve your skills to an area where you felt comfortable being a practice owner and then eventually going into a mentorship role?
So growing up, I was always an entrepreneur. And some people just kind of have that itch of being an entrepreneur. In kindergarten, in middle school, I would sell Pokemon cards or Yu-Gi-Oh cards. And ever since, I just did some sort of entrepreneurship. In dental school, I didn't care to be in the top 10 because I knew, I wanted to do general dentistry. So I got to focus my time on shadowing doctors or learning how to buy a practice. And I even read the book, How to Buy a Dental Practice. In doing so, that's kind of what I'd put most of my time and energy to. I just knew I could never work under someone. I had to be the guy at the top. And so when I was graduating, I knew that's what I wanted to do. I didn't have an opportunity when I graduated, so that's the reason I was applying for jobs. But my goal was, hey, I want to create a practice in my hometown. And we lucked into that one. So that was a good opportunity. And from there, the reason I like to do the coaching aspect is I'm constantly thinking about what can I create, because as an entrepreneur, I get the itch to want to create something, whether that's practicing as a practice owner and learning as much as I can. But at some point you reach the cap. Now I'm not going to be challenged anymore. Dentistry, after you do it for a little bit, you realize dentistry is easy. People management is hard. And so I have to be challenged, and for me to take the next level challenge, I needed to create something that would challenge me, and that was one of those things that I realized
That makes a lot of sense. And you and I, outside of the podcast, have had a conversation about CE, continuing education, before. So for your doctors that you bring on, or just anyone that you talk to, what are some of the CE programs that you recommend, and how can people kind of figure out what's the best thing for them to start with?
So I think everyone at some point has to take some sort of root canal type of course. You got to know how to pick people in, and you have to know how to extract. More people are afraid to do root canal. So I always like to say, take a root canal course. If you want to know how to access, then there's a course by Steve Buchanan in California. If you want to know how to do a root canal efficiently and do it well, there's a root canal course by Aaron Nicholas called the 1 Hour Molar Endo Build-Up Crown. Those are for root canals. If you want to know how to talk to people, if you want to know how to sell dentistry and be a comprehensive caring dentist, then I recommend taking Arrowhead's curriculum. I'm a big fan of Arrowhead. That's one of the courses I send all my doctors to as a requirement. I even tell them I will pay for it because I know it's going to give me my ROI immediately. A lot of people will take these implant courses and they'll be ready to do implants, but then they're not able to sell the implant. And because they don't know how to talk to the patient to convince them that they need it. So I always like to say, clinical skill is important, but if you can't sell it, then what was the purpose of learning it? Because now you're not able to offer that as a service to anyone. So no one won at that point. So Arrow is my number one course I always start with. Learn how to talk to people and sell and be a comprehensive dentist. And then after that, work on the individual niche skill sets.
Yeah, that makes a lot of sense. And talking about the associates that you employ, I want to know a little bit about your process of hiring and interviewing. How are you evaluating people, and maybe what advice do you have for someone that's going through a job search?
So I will say I've had the whole spectrum of dentists. I've had the ones that are amazing. I've also had the ones that are not so amazing to where they're throwing instruments to patients. Crazy stories. One advice to dentists: don't throw instruments to patients, please. You'll lose everything at that point. When I interview a dentist, I like to know where they stand objectively from a confidence level first. I like to say 1 out of 10 rate yourself on fillings, crowns, etc. to see where they stand. That allows me to know what type of feedback that I need to focus on. So if someone's rating themselves like a 3 on fillings, then I know, hey, I have some work to do to help them get to 7 or higher. If someone's already at a 7, then I know, hey, I don't need to focus on fillings. Let me focus on other priority stuff. So that at least gives me a starting base on what to focus on regarding training. I also look for personality. So some dentists are, they're robots where you put them in a practice, they'll do the dentistry, but then they don't really want to talk to people. And we forget that in this profession we're in a people profession. So I want to be able to see people and communication personalities in dentists. The skill set can be trained. Personality cannot. And so what I look for is the highest priority is the ability to talk to people and just be a normal human and caring person, and nice and communicative and social. After that, the skill set I can train, or I can send you to a course to help better.
So you definitely recommend people are very transparent about their strengths and weaknesses when it comes to their clinical skills, because I can imagine some new grads might be a little embarrassed to maybe be honest, like, oh, my school doesn't do a lot of endo or something, for example.
Yeah, I think if you're not transparent, then you might be put in first day to go do a root canal. And now you don't help anyone. You don't help yourself, and you definitely don't help your patient in that sense. But if you're able to be transparent and tell the dentist, hey, this is what I rate myself in that procedure, but I'm here looking for mentorship, and you show the desire to grow, every dentist wants to help. They want you to grow because when you succeed, they succeed too. So the more transparent you are, the more feedback they're able to get from that, and they're able to give to that.
Yeah, I definitely agree. It's so key. And you'd assume that new grads want to be improving their skills, so they're looking for an office with mentorship. So it's important to be clear about where you think you need mentorship at the first place too. So kind of on that topic of knowing your own strengths and weaknesses, how do you recommend that associates go about challenging themselves to improve their skills and taking on harder cases that are maybe pushing their limits a bit without going too far where a patient's at risk or they're being a little bit negative?
So I think the number one rule of wanting feedback is to ask for it. So when I was starting off, I would ask a patient at the end of every procedure, hey, tell me one thing that I could have done to make this procedure better for you, whether that was the experience or my procedure itself. And I would take that feedback, hey, your shot hurt me. And I would say, okay, I got to figure out how to make these painless. If I was too slow, hey, could I have been faster? And just getting that feedback. So for doctors that are graduating and working for someone, if they're able to ask the doctor that leads them, hey, can you give me feedback? Am I going too slow? What is my standard that I need to be at? For example, should a crown be an hour or an hour and a half appointment? If I'm doing 2 hours, now I have a threshold to aim for. And ask the patient. I think the patient and the doctor team you're with, that makes such a difference by you just asking that question.
Yeah, that makes a lot of sense. And it's interesting that you mentioned that because I hadn't really ever thought about actually asking the patient. I feel like at the end, they'll say like, oh, like, thanks so much. Like, I appreciate like you helping get me out of pain, or like you helping them with the dentistry that they needed. But I don't particularly say like, so how was it? I usually ask little kids or people that are super anxious to see like, okay, wasn't so bad, right? But for just a normal patient, that seems like dentistry is no big deal to them, I don't always remember to check in and see like how did it go for them.
And you'll be surprised. Some people, it's their first filling, it's their first extraction, and no one ever thought to ask. It's kind of like one of the biggest practice builders I tell doctors: call your patient at the end of the day and ask them how they're feeling if you injected them, because they'll tell you, wow, no one ever called me. I've been to every dentist in the world, every medical doctor. No one's ever actually called me, the doctor, him or herself, and asked me how I'm feeling after my appointment. And that is a big practice builder. And when you're able to take that to the clinical component, when you're asking every procedure, especially as a new dentist, hey, could I have done anything better to make your experience? Either they'll say, no, you were good. Then great, that's what I want to hear. Leave me a review. If they say, well, you could have been faster, then hey, thank you for that feedback. I want to improve for you. And so that's what helps really when you're able to get that constant feedback.
Definitely like that. I'm going to keep it in mind. And you mentioned that
my shots now, they're definitely
Go ahead.
now. So I think 3 years running, I tell people, if you feel my shot, I will give you a refund. I'm that confident in my shots now. So definitely painless technique.
That's impressive. Yeah, I wouldn't say I'm 100% painless, but maybe like 60% of the time people say, I didn't feel it at all. But there's definitely some times where it's not quite there yet.
So it's a good technique.
Yeah. And you talked about having a dental assistant program. Can you tell us a little bit about that?
Yeah. So having multiple practices, the job market's kind of always existing where you are always losing people or needing people. People are taking time off, starting families, etc. So we realized with multiple offices, to be able to control that job market, it made sense to have a dental assistant school, because that's the number one position that has the highest potential of growth, but also of need. So having that, we get to kind of cherry pick the best people of our class and put them in our clinics, but also help the community and create more jobs, because now other dentists around get the benefit from that.
And is there a pretty high like interest rate in your program? Is it full every time? Do you take as many people as are interested? How does it work?
We take about 12 students a semester and 3 semesters in a year. Right now we're at 12 because of just how big our building is. And there's been a good amount of interest, especially when college students are graduating or high school students are graduating. They now are able to add a resource to their tool belt. And if they're going to go to college, you get to now, have a way to pay for college while you're in college. So a lot of high school graduates love that. It's a 13-week program. So you get done in about 3 months. And so it's a lot of benefit for high school graduates and just people that can benefit from it.
Yeah, that is really cool. I feel like the dental assisting schools, at least like the area that I'm from, I don't really know anything about the area I'm practicing in yet. There's assisting schools, but where I'm from, they're having such a hard time even filling the program. So there's definitely a big shortage.
We have like a bunch of dental clinics around, but there's only 1 or 2 dental assistant schools, but they're further away. And so it's a nice opportunity that we're bringing to the table. And it's not something that, we're carrying to make millions of dollars from. It's more of, hey, it helps our company too. So it's a mutual win from that.
And how is your week kind of split up between practicing clinically, admin work, working with the hygiene school, working with the assisting school, working with your coaching? How do you split up your work week?
So I think you recently had D'Angelo Webster on there, who's a great mentor and a colleague. And one of the things he had asked me once was to talk to you about was time management. I'm a big believer of delegation. There's a great book, so big book reader. There's a great book by Dan Martell called How to Buy Back Your Time. Highly, highly recommend. But the book talks about how to create time through delegating and empowering people. So my structure is I clinically practice 2.5 days a week. I think within the next 90 days, I'll be at 2 days clinical, which is my sweet spot because I don't want to give up my clinical skill. I'm still young and hip and I still enjoy dentistry. But it gives me now 2.5 days to be able to lead my company to the next level. For my dental assistant school, I have my sister run that. So I meet with her on a weekly executive basis. And so that's kind of the culture that I'm trying to create is I don't want anything to depend on me, because if it is and it's not system dependent, it's me dependent. My goal is to empower every single person part of my company to be dependent on them, but then use me as strategic guidance to make sure everything goes well.
This episode is brought to you by Allstate. Some people just know they could save hundreds on car insurance by checking Allstate first, like you know to check the date of the big game first before you accidentally buy tickets on your 20th wedding anniversary and have to spend the next 20 years of your marriage making up for it. Yeah, checking first is smart. So check Allstate first for a quote that could save you hundreds. You're in good hands with Allstate. Savings vary. Terms apply. Allstate Fire and Casualty Insurance Company and Affiliates. Northbrook, Illinois.
This episode is brought to you by Etsy.
Oh.
Hear that?
Okay. Thank you.
Etsy knows these aren't the sounds of holiday gifting. Well, not the ones you're hoping for. You want squeals of delight. Happy tears.
How did you?
And spontaneously written songs of joy.
I am so happy. Oh yeah, oh yeah, oh yeah.
Okay, the song needs a bit of work, but anyway, to get those reactions, make sure everyone on your list feels heard with handmade, handpicked, and designed gifts from small shops on Etsy. Gifts like personalized jewelry, custom artwork, cozy style items, vintage pieces, and home decor to celebrate all of your favorite people and their specific kind of special. For original gifts that say, I get you, Etsy has it.
Yeah, I mean, I knew you would have a good answer because you do everything very well. And I totally agree with you. If I did go to the direction of practice ownership and mentorship and everything, exactly what you said, there has to be systems in place where it's not all about you specifically. It's about what you created and having that function well on its own
that's
too.
What the legacy is, right? If it's dependent on me, then it's not a legacy anymore. It's just me. If it runs beyond me, then that's what the legacy is.
So before we wrap up here, I like to give people a chance just to like leave a final piece of wisdom or something that's really helped you, a general thought or something like that.
I guess the biggest thing for me would be willing to spend money. And what I mean by that is not just go shopping spree, but spend money on people that are better than you in any way. So there's so many coaches out there. There's so many dentists out there that are killing it, doing amazing things. Find your who. A great book, Who, Not How. Find your who, which means find the person that you want to be like and just physically go do what they did to be like them. I have that person for myself, and I know exactly what that person did, and I'm on track doing what that person did to achieve the goals that he did. I'm doing so right now. So the piece of advice is find your who and spend money if it takes money to be able to create that opportunity for you to get to that level too.
That's very good. And it's good to push people because I think we can all be a little bit stingy when it comes to finances and kind of be stuck in more of that scarcity mindset of just kind of fearful about when it comes to money, especially coming out of school with such large debt load. But you're there to say that it's investing in yourself is going to pay off. And
it's like having a fitness coach. We all know how to lose weight, but when you pay money for a coach, surprisingly more people statistically lose weight when they have a coach versus not. And so it's not that they don't do anything majorly different. They all still, you got to lose weight, exercise, eat right. The coach just provides an invested accountability that you couldn't have done by yourself.
That's a really good analogy. I like that a lot. And thank you so much for all of your time tonight and all the wisdom you shared. I will definitely be sending people your way. But what is your Instagram if they have any more questions for you or want to reach out?
I think my Instagram is Dr. Rehan Shahid. You could find me on Instagram or email me if you need to. Dr. Rehan Shahid, dds@gmail.com. And I'm always happy to provide mentorship or answer any questions that I can.
Thank you so much.
Thank you, Haley.